some unfounded ideas or theories about the coronavirus. There's going to be ideas that I have, and they have no foundation in science. It just sounds good on paper and something to think about. I'll start with the weather. So far they explained on California, for example, they say they have very good numbers compared to New York, which is the epicenter of the coronavirus in the US. And they wonder why. One of the reasons is because they think Corona or California enacted social distancing a few days before New York. That could be it. Another theory could be that the weather has a relation to it. How humid is it, or how hot it is, because it does have a relation to, like in the summer, for example, they say the viruses and bacteria has much harder time spreading because they cannot survive the heat, and even in drier areas they like more humid areas. So what's the relation? I haven't seen much about it. Scientists haven't found, or didn't have the data, or they don't have enough data, I don't know what, but it could be that weather has major influence on why, for example, in California it has much less. Another reason why some places have less or more is the idea of density. How dense is the city? New York is an extremely dense area. In California, even though maybe just in downtown LA or downtown San Francisco, this is very dense, but California in general is a very dispersed state, and people living much apart. Most of it is suburbs, and that could have a relation for how many people are getting affected. It's all about density. The idea of density comes also with the idea of number of viruses you are encountered. Because what happened with viruses, you are able sometimes to go, and that's another part of this theory. It's all about theories here. Don't take everything with a grain of salt, as they say. So you are able to fend, your immune system is able to fend some amount of the viruses, But when you have more of them, you're much less likely your immune system will collapse eventually and you will get sick. And when you have density, you have a lot of people around you, it makes you more likely to get the virus eventually, because there is more of them. So let's take an example. There is Starbucks in California and Starbucks in New York. The door, how many people are going through that door? How many people are touching that door? So in California it could be, I don't know, a few hundred people are touching that door. In New York could be thousands of people. Downtown New York, Manhattan, you have thousands of people touching the same door. So it's about, you can see why spreading is much more effective in New York versus in California. So, and also you have subways in California, and then, in New York you have the subway, which is much more people confined in one very small area, and spreading again is much more likely to happen. You have big buildings, so everyone are touching the door of the building. Here, everyone has his own apartment, everyone has his own door, their own door. So many things like that has the relation between density and the number of viruses you are encountered. Even in a store, even a grocery store, how many people are in there also has relation to how many people will get affected. Another something to think. Another something that is related to that is also the idea of immunity. Could be also that in some parts of the country, in some parts of some countries, there is more immunity. And they're already talking about this idea as they have antibodies. They want to develop antibody tests to see who already got it and who didn't. Because whoever's got it is already immune, and they can go around, do whatever they want to do. But whoever is not is much more likely to get it. So it's important to know who got it, who didn't. But what we see here is that there is the idea of immunity, because people could have it and get immune to it. So many people already got immune to it, which means that we are able to fight this virus successfully. The question, how many people would be able to do it, it's another question. That's why also it's relied it's related to the idea of density in the number of viruses, because the less number of viruses you have around, the less people are infected are around, the more likely your immune system to fight the virus successfully, because there is less of them, and you're much more likely to get immune to it eventually, because you have only 10 and your threshold is 20. That's the maximum number. You can do 10 easily and then get immune to it. But if you get exposed, again, your limit is 20, you get 30, your immune system collapses, you're not going to get immune to it, you're going to get sick, and you might die. That's a problem. But when you get immune to it, that's a better idea. But there is, I think, that in South Korea, that people got reinfected with the virus, which is also related to the idea of how many viruses around. So let's say you got immune to it once. You're immune to the virus, but how long? That's another idea here. How long would be, or how many can you fend off even after you're immune to it? It's more likely, let's say your threshold was 20, but you can fend off 30, 40, 50, 70, 80. But what happens if you get 100 or 200? So for example, for healthcare workers, it's going to be interesting and important, because even if you get an antibodies, for example, that's what they want to do, get people antibodies to transfer blood and things like that. Even if you're immune, how many viruses can you fend? So that means that you can go with no suits and no gloves and still be good. I think there should be a number of viruses that even if you're immune, you can still not fend off successfully even after immunity. The last idea is about nose breathing and clearing the nose. So that's a respiratory virus. It's a respiratory issue, which means that if we have a better respiratory system, so we have a clear breathing, or actually working on respiratory strengthening, so for example running or any other physical activity could help, which also could be not helping, maybe it's too much, but you have to find the balance of still working, still making the system work enough and develop the system that is going to be clean. So running and exercising or whatever, but not too much, and the heart and the lungs would not work and will not function right. And but that's another part of it, is also nose breathing, because we have the nose, especially when you go around in public, try to breathe more through the nose, because the mouth, you don't have the filtration. One of the reasons we have the nose, there's a lot of hairs in there. It's not my idea, but there's a lot of hairs, and that's supposed to filter through some problems. So bacteria and viruses. So be very conscious about breathing through the nose, especially when you're around people and you're much more likely to get it from them. So breathing through the nose is actually supposedly more safe than breathing through the mouth where there is no filtration at all. And therefore you have to have a clear nose in order to breathe through the nose in the first place. So that's another part of it. Because it is a respiratory issue, and we should be mindful of how we breathe, or breathe deeply more and breathe better in general could be work, and be more conscious about our breathing could also be helpful. So again, some ideas, none of it is founded. And because you can go around if you don't want to do some more research about it. I didn't, but just some ideas that I found interesting. Thank you.